Is paroxetine safe while breastfeeding? When it comes to the question of whether paroxetine is safe while breastfeeding, it's essential to look at the facts. Paroxetine is a selective serotonin reuptake inhibitor, or SSRI, often prescribed for conditions like anxiety, depression, and post-traumatic stress disorder, commonly known as PTSD. For mothers dealing with PTSD, managing their symptoms is crucial not only for their own well-being but also for their ability to care for their child. Current scientific consensus suggests that paroxetine is generally considered one of the safer antidepressants for breastfeeding mothers. Research shows that paroxetine does pass into breast milk, but the amounts are typically very small. In fact, studies indicate that the levels of paroxetine found in breast milk are low, and the amount that a nursing infant might ingest is minimal. Interestingly, in studies involving breastfeeding mothers taking paroxetine, the medication was not detected in the blood of their infants. This is a reassuring finding, as it suggests that the risk of significant exposure to the baby is low. Even when mothers are on higher doses, the concentration of paroxetine in breast milk remains low enough that adverse effects in infants are rare. For mothers with PTSD, the benefits of continuing treatment with paroxetine often outweigh the minimal risks associated with breastfeeding. Untreated PTSD can have serious implications for both the mother and the infant, potentially affecting their emotional and physical health. Therefore, maintaining effective treatment is vital. However, it's important to remember that individual responses to medications can vary. Some infants may be more sensitive to medications than others, and while side effects are rare, they can occur. Mothers should be vigilant and monitor their babies for any unusual symptoms, such as excessive sleepiness, poor feeding, or irritability. If any concerns arise, consulting a healthcare provider is essential. In summary, paroxetine is widely regarded as a safe option for breastfeeding mothers managing PTSD, as long as both mother and infant are monitored by a healthcare professional. The decision to use paroxetine while breastfeeding should always be made in consultation with a doctor, who can provide personalized advice based on the mother's medical history and the infant's health. Always consult a healthcare provider before starting, stopping, or changing any medication, especially during pregnancy or breastfeeding. This ensures that treatment is tailored to individual needs and minimizes risks for both mother and baby.